Hi, I'm Kimberly Llewellyn, and for my project, I did it on the delayed recognition in patient deterioration. And for my case study, the patient, Camille Johnson, who is a 68-year-old female, was admitted to the med-surg unit with a diagnosis of pneumonia. Her medical history included hypertension and type 2 diabetes. She was started on antibiotics and oxygen therapy, but Mrs. Johnson's vital signs at admissions were within the normal limits, and her respiratory rate was at 18 breaths per minute. On the second day of admission, the nurse assigned to Mrs. Johnson noticed that the patient's respiratory rate was increasing, but she attributed it to anxiety. The nurse instructed the patient to take slow, deep breaths and use the incentive spirometer every hour. The nurse also administered anti-anxiety medication to the patient. On the third day of admission, the nurse noticed that Mrs. Johnson was becoming more lethargic and less responsive. Her respiratory rate had increased to 30 breaths per minute. Her oxygen saturation had dropped to 88% despite being on 4 liters of oxygen via nasal cannula. The nurse notified the provider and the patient was transferred to the ICU for further management. Mrs. Johnson was diagnosed with ARDS, acute respiratory distress syndrome. Upon review of the chart, it was noted that Mrs. Johnson's vital signs had been trending upward since the second day of admission. However, the nurse failed to recognize the early signs of patient deterioration and did not escalate care in a timely manner. The delay in recognition of Mrs. Johnson's declining condition may have contributed to her development of ARDS and the need to be transferred into the ICU.